Today we are going to continue with episode number 6 of our weight loss series called Science of Eating with Diabetes. And today's topic would be what foods to eat. Welcome everyone. Thanks for coming to sehatalks, a YouTube channel. Lately, I've been receiving a very good response from my viewers on the series. The series is intended for the common people to know the basics of healthy eating, their healthy eating habits, especially the population with diabetes mellitus, who can benefit overwhelmingly with better food selections. I believe, and the current evidence-based medicine is also focusing more and more on better and healthy diet and additionally lifestyle changes. The key of a healthy life is in a healthy diet along with the healthy lifestyle. I will share the good news for the diabetics that they can eat everything. Yes, you heard it right. If you are a diabetic, you can eat everything, period. Medical nutritional therapy is a key component of diabetes management. The importance of balancing the macronutrients, reducing the carbohydrates load, lowering the glycemic index, and implementing an overall healthy dietary pattern. These are the emerging and better approaches for medical nutritional therapy in diabetes. Recent research points to improved glycemic control, reduction in the body weight, and improvement in many cardiovascular risk factors when these approaches are provided by registered dietitians or healthcare professionals. Nutrition and physical activity are important parts of a healthy lifestyle when you have diabetes. Along with other benefits, following a healthy meal plan and being active can help you keep your blood glucose levels, also called blood sugars, in your target ranges. To manage your blood glucose, you need to balance what you eat and drink, along with physical activity and diabetes medications if you take any. What you choose to eat, how much you eat, and when you eat, these are the all important questions in keeping your blood glucose level in the range that your healthcare team recommends. Becoming more active and making changes in what you eat and drink can seem a challenging task at first. You may find it easier to start with small changes and get help from your family, friends, and above all, your healthcare team. Now, having diabetes means going without foods you enjoy. Is it so? The good news is you can still eat your favorite foods, eat smaller portions, or enjoy them less often. This is the way out. Your healthcare team helps create a diabetes meal plan for you that meets your needs and likes. Now, talking about the food groups, the key to eating with diabetes is to eat a variety of healthy foods from all food groups and in the amounts that your meal plan outlines. The main food groups include the vegetables, the fruits, the grains, the proteins, the dairy, non-fat or low-fat, hard healthy fats. So in this session, I will discuss and enumerate the common food groups that you can have in your diet, which is the main topic of our discussion, what to eat. The vegetables would include non-starchy vegetables like broccoli, carrots, greens, pepper, tomatoes. Starchy would include potatoes, corns, and green peas. These are the vegetables that you easily can take. The fruits, with the common fruits that you are allowed to take in a weight loss plan with a diabetes or a healthy diet include oranges, the melons, the berries, apples, banana, and the grapes. The grains include at least half of your grains for the day should be whole grain, which includes wheat, rice, maybe oats, cornmeal, barley, quinoa. These are the grains that are whole grains that you can very well take in diabetes. Like as the whole grain is there, then you can take bread, pasta, cereals, and tortillas as well. Talking about the proteins, lean meat, chicken or turkey without the skin, fish, eggs, nuts and peanuts, dried beans, certain peas like chickpeas, split peas, these can be taken very well. The meat substitutes such as tofu can also be taken. Dairy products would include non-fat or low-fat. Milk or lactose-free milk, if you have lactose intolerance, you can take that one. You can take yogurt, you can take cheese. The big question about fats. The foods with heart-healthy fats are the targets for diabetics. These would include mainly the foods that come from oils that are liquid at room temperatures, canola and olive oil, nuts and seeds, heart-healthy fish such as salmon, tuna, and mackerel, and maybe you can include among the food groups avocado also with the fats. Used oils, the usage of oil when cooking the food instead of butter, creams, shortening, or stick margarine. These are the kind of foods that can be better adjusted in case if you are diabetic. Now, talking about what to limit and what not to eat, maybe depending upon their choice. Fried foods and other foods which are high in saturated fats and trans fats, foods which are high in salts, we call sodium, sweets such as baked goods, candies, and ice creams, beverages with added sugars such as juices, regular soda, regular sports and energy drinks. These are the things to avoid. Now, another question which is commonly asked and very important for the diabetics to understand: when should I eat if I have diabetes? Some people with diabetes need to eat at about the same time each day. Others can be more flexible with the timing of their meals. So depending upon your diabetes medications or the types of insulin, you may need to eat the same amount of carbohydrates at the same time each day. That's a daunting task. If you take mealtime insulin, your eating schedule can be more flexible. If you use certain diabetes medications or insulin and you skip or delay a meal, your blood glucose levels can drop too low and you can go in a hypo. So it's better to ask your healthcare team when you should eat and whether you should eat before and after the physical activity. So these were the important points I wanted to highlight in today's discussion. Thank you for coming to the channel. Stay safe, stay healthy, and if you like the content, please like, subscribe, and share. Take care of yourself. Bye.